Welcome to the Deep Dive. We love taking complex topics and, well, diving deep into them. Today we're looking at a 2024 study from the Journal of Small Animal Practice, all about a tricky neurological condition in dogs.
Yes, this one is caused by the parasite Neospora caninum. And we're going to get pretty technical with this deep dive, so buckle up if you want to really get into the nitty-gritty.
I am so ready to get technical. This study, though, it looked back at 41 cases from 2 UK referral centers between 2014 and 2023. What kind of key takeaways did they find?
Well, first, the study focused on adult onset cases, which is interesting, because caninum is usually known for causing problems in puppies.
That is interesting. So I guess that means the way it shows up in adult dogs is like totally different.
Yeah, in some ways. See, we used to think there were these two typical presentations, a juvenile form with like hind limb issues and then an adult form with cerebellar problems. But this study, it only found those classic cases in a small percentage.
Oh, really? So what were they seeing then instead of the typical presentations?
Well, most dogs, surprisingly, presented with multifocal neurological signs, like 46.3% of them.
Multifocal. So multiple areas of the nervous system.
Exactly, meaning multiple areas of the brain or the nervous system were being affected.
Okay, so not the textbook cases. Got it. I mean, that really changes like the whole picture of how this parasite impacts dogs.
Yeah, it does. Clinically, these dogs had a much wider range of symptoms, too. Some did have the typical hind limb weakness, or a wobbly gait, but a lot of them had a mix. Gait abnormalities, weakness in all four limbs, balance problems, even just general things like weight loss and being lethargic.
Wow, okay, so we've got this parasite potentially affecting like multiple parts of the nervous system. How do vets even figure out what's going on when a dog comes in with all these different symptoms?
Well, that's the tricky part. It's a real diagnostic challenge. We mainly use two tests to look for caninum, serology and PCR. Serology is a blood test. It detects antibodies against the parasite. So it tells us if there's been exposure. And PCR, well, that's done on cerebrospinal fluid. It looks for the parasite's actual DNA.
Okay, so two tests. But, and I'm just guessing here, it's not always that simple, is it?
You got it. It's not. This study actually found over half of the dogs had a negative PCR test, even though they had high levels of antibodies in their blood.
Wait, hold on. So they had evidence of exposure to caninum, but no detectable parasite DNA in their spinal fluid. Doesn't that make diagnosis, like, really hard?
It does. It's a big problem. That's why relying on just one test could mean you miss cases. This study really, really highlights how important it is to combine both serology and PCR. And of course, look at those results alongside the dog's actual clinical signs. That's how you get a more accurate diagnosis.
That makes a lot of sense. Because if you just did the PCR and it was negative, you might think, oh, it's not caninum, and move on. It sounds like a real puzzle for vets to figure out.
Oh, it is. A puzzle for sure. And it makes it even more important to consider caninum testing when the signs are atypical or multifocal, like the ones in this study.
Okay. Speaking of getting a clearer picture, I know MRI is often used in neurology. What did the MRI findings show in these dogs? Like, what did the scans reveal?
Well, MRI was done in most of the cases, and often it did show changes that matched the dog's neurological signs. So say if a dog was showing cerebellar signs, you might actually see abnormalities in the cerebellum on the MRI. Makes sense, right?
Right.
Yeah.
But I have a feeling it wasn't always so straightforward, was it?
You're catching on quick. You're right. It wasn't. Almost half the dogs had multifocal lesions on the MRI, but those didn't match up with how they were actually presenting. So you might see lesions in areas of the brain that you wouldn't expect based on the dog's symptoms.
Wow. Okay, so even with advanced imaging, there's still some uncertainty. Did this study say anything about how these MRI findings compare to other neurological conditions?
Oh, this is where it gets really interesting. These MRI findings, they can actually look really similar to another condition. It's called meningoencephalitis of unknown origin, MUO for short.
MUO, well, it's a new one.
Yeah, MUO is basically a diagnosis of exclusion. We rule out all the other possible causes, and then we land on MUO. But here's the thing. Caninum. It can mimic MUO on MRI. So it's super crucial to include caninum testing when you're working up a suspected MUO case.
So even if a dog looks like a classic MUO case, vets shouldn't rule out caninum without doing the specific tests.
Exactly. And it's especially important to think about caninum in certain breeds, like retrievers and sighthounds. The study found those breeds are commonly affected.
Okay, we're starting to see how complex this is. Diagnosing caninum in adult dogs. But, okay, the big question.
Yeah.
What happens to these dogs once they are diagnosed? What are the outcomes like? I mean, that's the million-dollar question.
That's the burning question, isn't it? And to be honest, the study doesn't paint the most optimistic picture.
Oh, that sounds good.
Yeah, complete recovery was really rare, only seen in about 5.6% of the cases.
5.6%. Wow. That really emphasizes how serious this infection can be.
And it gets a bit worse, I'm afraid. The relapse rate was actually pretty high. Almost 28% of the dogs had a relapse of their neurological signs, I mean. And get this, these relapses, they could happen months, even years after the initial treatment.
Oh, wow. That must be so hard for, like, both the dog and the owner. You think everything is fine, and then bam, the symptoms are back.
I know. It really shows how unpredictable this infection can be. Sadly, over 30% of the dogs in the study ended up being euthanized because their condition was so severe.
That's heartbreaking. Is there anything, though, that can help predict which dogs might do better or worse? Like, are there factors that influence the outcome?
Well, that's where it gets tricky again. This study couldn't say for sure what predicts the outcome, but there were some patterns.
Like what kind of patterns?
Like dogs that had abnormal findings in their cerebrospinal fluid, like increased cell counts or protein levels, they tended to have a poorer outlook. Also, dogs with contrast enhancement on MRI, that suggests there's more active inflammation. Those dogs seem to have a less favorable prognosis.
So those are like red flags, things vets can look for.
Exactly. Potential red flags. Now, the study did look at the use of antibiotics, like clindamycin and trimethoprim sulfidazine, and they also looked at anti-inflammatory steroids. But because it was retrospective, it couldn't really say which treatment worked best or what factors may influence treatment response.
I see. It makes sense. It's hard to isolate all those variables when you're looking back. So it sounds like we still need to learn more about the best way to treat caninum infection. In dogs, I mean.
Oh, absolutely. Larger prospective studies are really needed to give us clearer answers about how well different treatments work and what factors influence the outcomes.
I see. So while we're waiting for those bigger studies, what can vets and dog owners take away from this research? Like right now, what's the key message here?
I'd say the biggest takeaway is awareness. Caninum can cause a much wider range of neurological problems in adult dogs than we thought. We need to recognize those atypical presentations, and we have to understand how complex diagnosis can be.
And of course, we can't just rely on one test for diagnosis. We need both serology and PCR, and we need to be really careful about interpreting those results, especially when one of them is negative.
Exactly. And while there are treatment options, we definitely need more research to help refine our strategies and identify those factors that influence how a dog responds to treatment. It's a complicated condition, no doubt. But with knowledge and, a collaborative approach, we can try to provide the best possible care for our canine companions.
Well said. Now, you mentioned that a few cases actually did achieve complete recovery. Can we learn anything from those rare successes?
Those cases, even though there weren't many, they do give us some hope. It's interesting, both dogs were ambulatory when they presented, so they could still walk. A bit difficult, but they could walk. Their initial neurological deficits weren't as bad as in other cases.
So their initial condition wasn't as severe? Maybe that played a role.
Possibly, yeah. It's worth noting, too, that both dogs had MRI abnormalities, and those abnormalities were consistent with their clinical signs. So there was a clearer link between what we saw on imaging and their symptoms.
Did the study say anything about what treatment those dogs got, the ones that recovered completely?
They both got a combination, antibiotics and corticosteroids. One got clindamycin alone, the other got clindamycin plus trimethoprim sulfadazine. But it's tough to say for sure if that's why they recovered. Based on just 2 cases.
Right, of course. We need more data to know if a certain treatment approach is more likely to lead to complete recovery. This study also points out how long-lasting this infection can be. We talked about relapses, but the fact that relapses can happen years after treatment, that's pretty amazing.
It is. It suggests that caninum can, hang out in the dog's body for a really long time, maybe in a dormant state, and then reactivate later on.
So even if a dog seems to be doing well after treatment, we still have to watch out.
Absolutely. We need to stay vigilant, look out for any signs of relapse. And if those signs do come back, get them to the vet right away. Early intervention might help, minimize how bad the relapse gets, and maybe improve the dog's long-term prognosis.
This deep dive has really been eye-opening. It's shown us how complex caninum infection can be in dogs. It's a real puzzle to diagnose and manage. But I think we've given our listeners a much better understanding of this condition. At least I hope so.
Hopefully. I think so too. Awareness is key, really. The more we know about N-caninum, the better equipped we'll be to recognize it, diagnose it accurately, and ultimately provide the most appropriate care for our patients.
That's a great point. Well, on that note, thank you again for joining us and for sharing your expertise. It's been a pleasure.
It's been my pleasure.
Now let's talk about the dogs that unfortunately didn't have a good outcome. The study mentioned that a lot of them had those multifocal clinical signs and abnormal cerebrospinal fluid findings. Oh, and marked increases in muscle enzymes too.
Yeah, those factors definitely seem to be linked to a poor prognosis. And like we said before, a good number of those dogs were euthanized, either really early on within the first week of diagnosis or later because their quality of life was so poor.
It's a tough reminder of just how serious this infection can be. Are there any other, red flags, things vets and owners should be watching for? Did any other patterns come out of the data?
The study found that contrast enhancement on MRI, that indicates, more active inflammation, that was also tied to a less favorable outcome. It's another piece of the puzzle, right? Helps vets figure out how bad the infection is and make decisions about treatment.
So we're kind of building a profile here. Multifocal signs, abnormal CSF, elevated muscle enzymes, and contrast enhancement on MRI. All of those things point to a tougher prognosis.
Exactly. It's all about recognizing those signs and having those honest conversations with owners about the challenges they might face.
You mentioned earlier that the study looked at different treatments, antibiotics and corticosteroids. What did they find out about those?
Well, the study couldn't say for sure which treatment was best, but it did shed some light on what's being done right now. Antibiotics are usually the first line of defense. Clindamycin, trimethoprim sulfadiazine, those are common ones.
What about corticosteroids? I know those are often used for inflammation, but there's always that worry about them suppressing the immune system.
That's the crux of the matter, right? Corticosteroids are a double-edged sword, kind of. They can help control the inflammation from N-caninum, yeah. But we don't fully understand how they affect things in the long run. We need more research to know for sure, so we can make those decisions carefully.
So it's all about weighing those benefits against the risks. This study really highlights how much more research we need in this area,
Oh, yeah, for sure. We need more data to answer some big questions. What are the best treatment protocols for different types of N-caninum infection, What factors really predict how things will turn out? Can we develop new therapies that work even better?
Those are the big questions, aren't they? The ones driving future research.
They are. And to answer them, we need everyone working together. Researchers, clinicians, diagnostic labs, all of us trying to unravel the mysteries of this parasite.
One thing that stood out to me in the study was how much emphasis they put on the limitations of retrospective studies. They were really upfront about that.
Yeah, they were. They acknowledged that when you're looking back at cases that were managed in different ways, there's going to be some bias. It's tough to control for everything, and it makes it hard to draw firm conclusions about how well treatments work or what predicts the outcome.
That's why those prospective studies are so important, the ones where you can control the variables. They're the key to getting clearer answers.
Absolutely. Prospective studies give you that controlled environment where you can really dig into those key questions and hopefully find better ways to manage N-caninum in dogs.
Let's shift gears a little. What can vets do right now to improve how they diagnose and manage N-caninum? What are some practical steps they can take? Based on this study,
It starts with awareness, really. Knowing which breeds are more likely to be affected and really paying attention to what the owner is telling you about the dog's symptoms. If you hear anything that sounds like it could be neurological, especially if it's unusual or involves multiple parts of the nervous system, you have to think about N-caninum.
So even if it doesn't look like the classic presentation, vets shouldn't just rule it out without doing some investigating.
Exactly. And a thorough neurological exam is so important. You need to pick up on any subtle signs, any little things that might suggest something more complex is going on.
And then, of course, the diagnostic tests.
Of course. We've talked about this, but I can't emphasize it enough. Serology and PCR. You have to do both. And a negative PCR doesn't automatically mean it's not N-caninum. Especially if the serology is positive, you have to look at everything together. The test results, the clinical signs, the whole picture.
So it's like being a detective, right? You have to gather all the clues, the history, the exam findings, the test results, and piece it all together.
That's a great way to put it. And just like a detective might use different tools to gather evidence, vets need to think about all the tools they have. MRI, cerebrospinal fluid analysis. It's all about getting that comprehensive picture.
So it's not just about ordering tests. It's about choosing the right tests and then really understanding what those results mean, so you can guide the whole diagnostic process.
You got it. And once you've diagnosed caninum, then it's time to focus on managing it. There's no magic bullet, no one-size-fits-all approach. But understanding the treatment options and what they can and can't do, that's super important.
What are the mainstays of treatment for caninum? Right now, I mean.
Antibiotics are usually the first choice, the ones that target protozoal infections. Clindamycin, trimethoprim sulfatazine, those are pretty common. But we still need more research to know the best doses and how long to give them for.
And then there are corticosteroids for the inflammation. But we have to use those carefully, right?
Right. Corticosteroids can be helpful for sure. But there are downsides. They can suppress the immune system. So it's a balancing act. You have to weigh the pros and cons and make that decision for each individual dog based on their specific situation and how healthy they are overall.
Sounds like good communication is key here between the vet, the owner, maybe even a neurologist, throughout the whole process of managing this.
Absolutely. This isn't something you manage alone. You need to talk to the owner. Be open and honest about the diagnosis, the treatment options, what they can expect to happen, the chance of relapse. It all needs to be on the table.
So it's about being realistic and working together to give the dog the best possible care, even though there are a lot of unknowns.
Exactly. And staying up to date on the research is so important for both vets and owners. As we learn more about how to diagnose and treat caninum, how to predict what will happen, we can keep refining our approach and provide even better care.
You know, something you said earlier really struck me about caninum mimicking other conditions, like MUO. Can you talk about that a little more?
Sure. It's really important. Because the signs of caninum can be so varied, and even the MRI findings can look like other things, it often gets mistaken for other neurological conditions. MUO, especially.
Just so everyone's on the same page, can you explain what MUO is?
MUO stands for meningoencephalitis of unknown origin. It's a diagnosis we make when we've ruled out everything else, all the other possible causes of inflammation in the brain and spinal cord.
So a dog comes in with neurological signs, you do some tests, and you can't figure out what's causing it. That's when you think about MUO.
Right. But here's the tricky part. The symptoms of caninum and even what you see on the MRI can look a lot like MUO, so it's really hard to tell them apart just based on those things.
So how do vets make sure they're not misdiagnosing caninum as MUO? Or the other way around?
That's why those specific caninum tests are so important, the serology and PCR. Even if it looks like a classic case of MUO, you still have to do those tests to rule out caninum, or confirm it, of course.
So you always have to keep caninum in mind, even if it seems like it could be something else.
Exactly. And that's especially true for certain breeds, like retrievers, sighthounds. They're more prone to getting caninum.
It makes you realize that diagnosing these things, it's a process. You have to be careful. Observe the dog closely, do the right tests, and be open to all the possibilities.
It is. It's a process for sure. And with cases like caninum, where the signs can be so different from dog to dog, you have to be really thorough. That's how you get to the right diagnosis.
Yeah.
And then you can make the right decisions about treatment.
You know, one thing that's really hit home for me during this deep dive is how much we still don't know about caninum. There are so many questions that need answers.
It's true. We've come a long way in understanding this parasite, but there's still so much we don't know, and that's what makes this field so exciting.
It's about embracing the unknown, isn't it? And pushing the boundaries of what we know. What areas of research do you think are the most important? Moving forward, I mean.
There are a few key areas where research could make a big difference. Finding more reliable ways to predict the outcome, that would be huge. If we could pinpoint those factors that tell us for sure whether a dog is likely to do well or not, it would change everything. It would help vets make treatment decisions, and it would help owners understand what to expect.
That would be a game changer, for sure.
Totally. Another big one is figuring out the best treatment protocols. We need more data on which antibiotics work best, how long to give them for, whether other therapies like those corticosteroids really make a difference.
And of course, finding new treatments is always a priority.
Always. If we could find new drugs that are even better at targeting caninum and with fewer side effects, it would be amazing. It would make such a difference for dogs with this condition.
So we need to keep investing in research, exploring new possibilities, all in the name of better care for our furry friends.
Exactly. The future of caninum research is wide open. And with all of us working together, I think we can really move the needle. Learn more about this parasite and how to manage it.
Speaking of the future, are there any new diagnostic tools or treatments on the horizon? Things you're particularly excited about?
There are a few things in the pipeline that look promising. They're looking into new biomarkers, things that might help us assess how bad the infection is and get a better idea of how things will turn out. And for treatment, they're doing research on new drug targets and immunotherapies. Those could give us more targeted, more effective options.
So that dynamic field, lots of potential for progress. It's really good to hear.
It is. It's exciting. Even though caninum presents a lot of challenges, everyone is really motivated to find better ways to help our patients.
This deep dive has given us a lot to think about. Any final thoughts for our listeners before we wrap up?
Caninum is a tough one. Complicated, often challenging to deal with. But it's not hopeless. If we're aware of it, if we're on the lookout for it, and if we work together, we can really make a difference. For dogs with this parasite, I really believe that.
That's a great message to end on. Thanks again for joining us and for sharing your expertise. This has been really insightful.
It's been my pleasure.
So from a practical standpoint, what advice would you give to vets out there? The ones seeing these potential caninum cases every day. What can they do to get better at diagnosing and managing it?
Well, I think the most important thing is having a high index of suspicion, knowing the signalment, the breed especially, and really listening to the owner. What are they saying about the dog's symptoms? If you hear anything that even hints at neurological problems, especially if they're unusual or seem to involve multiple parts of the nervous system, you've got to think about caninum.
So even if it doesn't present in that classic way, vets shouldn't just rule it out without, digging a little deeper.
Exactly. Don't dismiss it too quickly. And a good neurological exam is crucial. You need to look for any subtle signs, any little inconsistencies, things that might suggest a more complicated neurological problem.
And then, of course, there's the testing.
Right. The testing, we've talked about this a lot already, but I can't stress it enough. You need both serology and PCR. And remember, a negative PCR doesn't mean it's not caninum, not if the serology is positive. You have to look at all the results together and consider everything else you know about the case.
It's almost like detective work, isn't it? Gathering all the clues, the history, the exam findings, the test results, and then putting them all together.
That's a great analogy. And just like a detective might use different tools, to gather evidence, vets need to think about all the diagnostic tools they have. MRI, cerebrospinal fluid analysis, those can give you a much more complete picture.
So it's not just about running tests, it's about choosing the right ones and then understanding what they're telling you so you can make the right decisions.
Exactly. And once you have a diagnosis, then you have to figure out how to manage it. There's no one right way to treat every case, but it's really important to understand the options, what we have available, and what their limitations are.
What would you say are like the cornerstones of managing caninum? Right now, I mean.
Well, antibiotics are usually the first thing we reach for, specifically the ones that work against protozoal infections. Clindamycin and trimethoprim sulfadiazine are commonly used, but we still need to learn more about the ideal doses and how long to treat.
And then there are the corticosteroids to help control the inflammation. But those have to be used very carefully, right?
Right. Corticosteroids can definitely be helpful in some cases, but we always have to remember the potential downsides. They can suppress the immune system. So it's about finding that balance, weighing the pros and cons for each individual dog, considering their specific presentation, how healthy they are overall. It's a decision you have to make case by case.
It sounds like communication is really important here between the vet, the owner, maybe a neurologist. Working together is key.
Oh, absolutely. You can't manage this alone. You need to talk to the owner. Yeah. Openly and honestly. Explain the diagnosis, the different treatments, what might happen, the possibility of relapses. Everything needs to be discussed.
So it's about being realistic, setting realistic expectations, and then working as a team to give the dog the best possible care.
Yeah.
Even with all the uncertainties.
That's it, exactly. And for both vets and owners, it's so important to stay current. Keep up with the research, because as we learn more about caninum, how to diagnose it, how to treat it, what factors influence the outcome, we can keep getting better at managing it.
This deep dive has really been amazing. It's opened my eyes to all the complexities of caninum in dogs. It's definitely not a straightforward condition. It requires a multifaceted approach, that's for sure. You need clinical expertise, scientific knowledge, and a lot of compassion.
It does. It does. But, I think this study also shows how much progress we've made in understanding this parasite. And I'm optimistic. I think that with more research, more collaboration, we can keep learning and keep getting better at helping the dogs in our care.
I agree. Well, thank you again for joining us and taking us on this deep dive. It's been incredibly informative and really got me thinking.
My pleasure. From Vet Neurojar, keep those minds inspired, hearts light, and tails wagging.